And if I think about, growth in the population and not growth in long-term care beds, right? We'll need another solution, especially over the next couple of years, of how do you deliver services for all those patients who are going to need a higher level of care, but there isn't actually a bed in a long-term care facility for them.
Exactly. There's not enough beds. It's too expensive to make the beds. And it's not cost effective to have people in beds. Not to mention that who really wants to go to a facility? If people can stay home and be taken care of from the comfort of their home, they'd much rather have that, be around their family, their friends. They can still have, access to their life that they don't necessarily feel like they have access to when they're in a facility.
Did you see a big change with the pandemic in that? It's something that I feel like was talked a lot about early on, of people now not wanting to go into a facility. So how has that changed the dynamic for you guys?
I think that facilities started to scare people during the pandemic. And, to an extent, I think facilities got a little bit of a bad rap.
Yeah.
It wasn't necessarily the fault of the facilities that this outbreak happened, but, they're just poised for things like that to happen. But I think that people really started looking at where am I going to age? And, people like me, I started to look, my parents are still young, though they won't like me saying that I'm thinking about them going into a facility. But, I started to think, what is going to happen to my mom and dad? I don't want them aging in a facility. I want them to age in the comfort of their home. So I think that there was a huge shift in the way that people thought about care. And I also think that COVID enabled a lot of different regulatory things that impacted not being able to provide care in the home. It enabled it to kind of open up and almost have beta testing on, does this work? Is this effective? Can this be done? I think that there was a lot of fear in healthcare that if we embraced telemedicine or if we embraced home programs, that the doctors that are at facilities or at hospitals or, these big integrated health systems that are built in the cities would kind of lose their purpose, but that's just not true. What it does is enables the providers who can take care of people in the home to take care of them more cost effectively, more efficiently. And then the patients who need to be either taken to a facility or seen by a system for some reason can go to that facility and they can be seen and they can be focused on the care that's provided there. They don't have to worry about the little things that can be taken care of in a home setting.
Yeah. So can you talk a little bit about sort of compare, contrast traditional long-term care where you're sending meds to a facility and often interacting with the nurses in the facility versus sending meds to a home? So what's the same, what's different?
So the biggest thing that you have in the at-home population is that a patient doesn't have a nurse to rely on providing medications. So when you're sending medications to a facility, you're actually sending them to the floor, and it's going to the lead nurse, and that nurse is handling the med pass, and you have someone who is licensed, taking these medications, handing them to that patient and making sure that they take them. In a home setting, that nurse piece is missing, but that's where the pharmacy can really embrace the medication management piece and provide the tools and the resources for patients who are capable and don't need that level of MedPass support to take their medications independently and effectively and still make sure that they're treating their conditions as they need to. So the pharmacist in a long-term care at-home pharmacy is still going to be packaging medication, consulting with the patient, doing DURs, doing medication reconciliations. All of that clinical care that you see in long-term care pharmacy is still happening in the at-home setting, but it's the end user of the medication and the end responsibility of a person taking their medication is that patient. It's that person.